When all this first started, she was 11. She was in year 6 at primary school. She was very happy and looking forward to starting Ripon Grammar School in the September.
I like see my friends and just normal stuff, I think. I like art and I want to do that for a job when I'm older. I do acting outside of school.
Her real flair at school is in all the artistic, creative type subjects. But she does fine academically as well.
I'm Molly Owen. I'm 15, 16 in a week and I live in Bishopmonkton, North Yorkshire. At the moment I'm doing GCSEs. Yeah, hopefully I'll pass everything.
Molly's a very outgoing, outspoken, lively girl. She's the eldest of 3 children.
So I've got a young sister, she's 10. I've got a younger brother and he's 14. And then my parents are both doctors. I've got a dog. Yeah. And my granddad, he lives down the road, so I see him a lot.
At the time this all started, she was generally doing really well.
Just living life, any happy memories really. I was just very young, loud, bossy, and just very happy, big person. Yeah.
She first noticed the lump, I think, about February half term of year 6. I remember I was making dinner and she said,
"Do girls get Adam's apples?"
And I said, no. And she said, "Oh, right, okay." And then said nothing else. And then I think it was probably about a week or so later, I was plaiting her hair in the mirror. And as I pulled her head back, I said, "What on earth is that?"
And I was like, "Yeah, that's my Adam's apple."
I said, "But you never said you had a lump. You just asked me a question." She said, "Oh, I thought you weren't bothered," sort of thing. So obviously I was really panicked as soon as I saw it. And I thought, oh God, she's got cancer. It's the first thing that comes into your head. But then, try and be realistic. I'm a GP. I see lots of people with lumps. And I also knew that thyroid cancer is pretty rare, and particularly in children. So I rang the doctors. We asked for an appointment. They were brilliant at the GPs. They saw us the same day. And he said, "Well, I don't know what it is, but we'll have to organise a scan." And that's when it all started, really.
Most people haven't really heard of the thyroid before. So the thyroid is a gland that sits in the neck. It looks like a pink butterfly. There's 2 halves and they're connected by the very thin strip in the middle. The thyroid gland produces a hormone. The word hormone means a chemical that is produced in one part of the body that acts in another. We tend to think of hormones as in the hormones of growing up when you're a sort of teenager. That's what we talk about, whether you'll be hormonal or this, but that's only one type of hormone. And there are many other different types of hormones produced by many other glands in the body, including the thyroid gland. The hormones that are produced in the thyroid gland act in every single cell of the body. And we call this hormone thyroxine. That's its name. That's what we often talk about. And it tells the cell of the body how fast to work. It's always more complicated than that, but that's the sort of classical way to look at it. If you have too much thyroid hormone, each cell is working too fast. And this can make people feel hot, make them lose weight. And classically, if you've not got enough thyroid hormone, your body's working too slowly, so you feel cold when you gain weight. the body monitors how much thyroxine it needs, and then it uses, believe it or not, another hormone to tell the thyroid whether to make thyroxine or not. And lots of hormone systems have this type of system whereby the body monitors it and then another hormone tells a gland to produce the hormone.
The doctor referred me to get an ultrasound. Ultrasounds aren't scary, basically. They just put a bit of cold jelly on a rolling pin-like thing, and they roll it over the place where you're like getting it, so your neck, and it just feels a bit cold. It doesn't hurt, and it's just a way to look inside of you.
I knew as soon as he put the probe on that it wasn't a cyst. This looked solid.
My mum was really sad because she thought like it was going to be like a nodule, but then it wasn't, and then she was like a bit sad about that.
Radiologist said, oh, well, this will need a biopsy. And I said, okay, thanks.
So when people have a lump, we as doctors often talk about getting a biopsy. Well, what does this mean? A biopsy means taking a very small sample of that lump and examining it under the microscope. And what we're trying to decide is, can we look at that tiny bit of that lump under the microscope and tell what the whole of that lump is?
They were like wanted to see what was inside the lump. It didn't hurt that much, just a bit uncomfortable. And like once you get it done, you feel relieved.
It's just some cells were removed, and it took less than 5 minutes.
After my parents bought me sweets and teddies.
And then we had to wait for the results of that, which was a sort of nerve-biting, I'm going to say 10 days.
But that was probably the worst thing. But then when I got the results back for that, they were like, oh, it's fine.
And I remember distinctly I was out for a run and my mobile rang, and I remember where I was on that run. Every time I run past it now, I think about it. And he rang the ENT surgeon and he said the biopsy just shows normal thyroid tissue. This is a benign lump. You've got nothing to worry about.
So then we didn't think anything of it.
And I just remember feeling so relieved. Three months passed, Molly started high school. We went for follow-up. So she went and had her bloods taken at the hospital and we came home.
Whenever I got a blood test, I always think, whenever you get it done in the hospital, it barely hurts, like literally nothing, because it's their job and they do it all day and they're really good at it. And when I got blood tests done, I think they were usually to test for my thyroxine levels.
And then I got a letter in the post that just said, surprisingly, Molly is severely thyrotoxic. I won't be looking after you anymore. You need to go to an endocrinologist. And then we got sent to endocrinology in Leeds. So Molly was overproducing one thyroid hormone, and I think that led all of us down a bit of a different path. The lump was kind of forgotten. So then we had quite a long period of time, I think almost 2 years, under endocrinology, trying to get her thyroid under control medically with tablets.
For like the next 3 years, if the lump continued to grow, which obviously is unusual if they're not thinking anything of it. So my mum like mentioned it to people that it was getting bigger, and they were like, oh yeah, we can see that. So that was kind of a concern, but nothing really was like done about it because we still thought it was benign.
The lump was just getting bigger. And I eventually said, is there a surgical option here? Because we can't get control of her thyroid with the tablets. She's got a big lump that you say is producing all this hormone. What happens if we take the lump out? These are photos of a couple of weeks before your first surgery. Yeah. I can't believe how big the lump is. It's really obvious on those photos there, isn't it?
Yeah.
Yeah. So we were glad to be rid of it, wasn't it? It was called lumpy. Remember?
Yeah.
On balance, they thought it was better to have surgery because if she had half her thyroid removed, the chances are, I think it was like 95%, that the other half would work normally and she'd never need any tablets.
When I first thought I was going to have surgery, I thought it kind of a good thing. I didn't really want to have a lump in my neck.
At this point, we were not facing a cancer diagnosis. We were just going to fix this problem that had been there for, 3 years. So in some ways, we were both kind of looking forward to it. She was quite happy to get rid of the lump. It had become quite unsightly by that point.
I remember being on the day quite scared because you have to go through a lot of procedures and obviously put on the robes and things like that, which is scary.
It's okay to be scared. That is a normal response. You might never have been to hospital before. We, the hospital, myself, the nurses, all the other doctors that work here, are here to make this scary journey as easy as possible. I do this operation multiple times a week. But for that young person and that family in front of me, this is not routine. Yeah. And every time we see someone, we need to remember that.
My area of specialty is looking after just thyroid patients. Talking to people if they come in for an operation, being able to explain about the operation, what sort of things to expect. I met Molly's mum, Rebecca. Rebecca was in very anxious state, understandably so, because she'd been taking Molly for appointments for many years and been told all along, no, it's fine, there's no worries.
Molly was listed for hemithyroidectomy, so the removal of the right half only of her thyroid, which was containing the lump, and leave the left half in place to hopefully just function normally. So for us, well, certainly for me and Molly, it was very exciting because to not have to take 7 tablets a day would be wonderful.
I actually had my own experience of thyroid cancer and surgery. I've noticed a lump in my neck, and so I sent a message across to our surgeons to say, I'm a bit worried about a lump I've got in my neck, please will you look? I had an ultrasound scan, the biopsy. The lump was over 2 centimetres, which is one of the guidelines of possibly looking at removing it. So they said, let's take it out and send it away. So I then had the operation, have the right side of my thyroid removed. So I have got the experience of knowing what people are going through, having the biopsy, having the ultrasound, knowing what it's like, waiting and not knowing what's going on. Mine did come back as it wasn't cancer though.
All right, thank you very much then. Bye.
The patient who's going to have thyroid surgery will come in on the morning of surgery, and then they will get to see me. They will get to see the anaesthetist who's going to put them to sleep. And they will get to see the nurses on the ward. And then they will come to theatre. And they will be looked after by the anaesthetist, who will put them to sleep in an anaesthetic room, which is right next door to the theatre.
I was allowed to go to the anaesthetic room with Molly and watch her be put off to sleep, and then waited on the ward for her to come back up.
And all I remember is them injecting me and then saying count to backwards from 10, and then I was asleep.
And then once that patient is asleep, they will come through to the main theatre, and then that is where I do the operation while the patient is asleep. At the end of the operation, the anaesthetist then wakes the person up, and they go back into a place near the theatre where they will first wake up, and this is what we call the recovery area. This is where we recover patients who have just had surgery. From there, you'll go back to the ward, and often better patients will stay in for just one night and they'll go home the next day.
When I woke up, I did feel quite ill and sore for a few days, but it's not nearly as much pain as you think it's going to be. And when I was in hospital for the night, I felt very grateful because there was lots of people, kids in there after having surgeries, having broken legs and things like that. So I think I felt a lot more grateful. But it is an uncomfortable place to have surgery because when you think about your neck, you think very delicate and things like that. But They're very good surgeons and it only takes a few hours.
She coped really well. We were in hospital for one night only, I think. She might have been a little bit worried about what the scar was going to look like afterwards. It's quite an obvious place, isn't it, on most people?
It's a bit freaky when you look at your neck and you've got all these different dressings and different things going on. When you get sent home from your operation, so you've got this little Steri-Strip tapes, you've got the glue on. Some people will get brought back to a clinic a week after to have those removed. Some people, if you're happy, you might get your parents or somebody to remove it or just remove it yourself. It can look quite sore. I feel quite uncomfortable. What I would say is it quite often feels quite numb. You might notice tingling sensations sometimes. The scar should heal well over the next number of months or years. My scar is 5 months old because I had my surgery in December. It's got less red, and we will expect that over the next number of years that the redness will fade. It tends to go white, disappears in the lines of your neck. If you're not happy with how your scar looks and it's not recovering quite as well, there are ways of dealing with it. I would say you need to use factor 50 on your neck because it is going to be more sensitive to the sun.
It looked beautiful. It was so good, that first one. You could hardly touch it, had anything done. She had about 3 or 4 days off school and then was back functioning normally.
I asked to keep it. They said, please can I keep the lump? When it came out and they were like, no, we have to get it tested, because I thought it'd be quite cool to have it on the side of my bed in like a bowl of water.
When I do a thyroid operation, I am removing the thyroid and the lump within that thyroid. I do not know from looking at it necessarily whether this is a cancer or not. So I send it off to our pathology lab. For the expert pathologist doctors to do their job to tell us if this was a cancer.
I felt like that was it. That was over. Like everything was going to be fine.
And then?
They found I had cancer.
We needed to have a follow-up appointment with the surgeon anyway, whatever the outcome, because he likes to check the scar, particularly in children. It was not what anybody had expected. It was a shock because the first time we saw the lump, I assumed it was cancer. And then I'd had maybe 2.5 years being told by lots of health professionals that it wasn't cancer. So by the time we'd had surgery, I'd sort of got past that, to be honest. At this point, I had finally been reassured by so many people that this was not a malignant lump, that I wasn't actually that worried about getting the results back because we'd been through so much. They'd done so many scans, they'd taken this sample.
When we came in, he said, oh, he said, Dad's here. And I was like, no, I knew something was wrong because I'd never come to appointment with my dad. Never like you two together. So when he asked like if my dad was there, I was thinking, well, what?
And we went into the room and he basically just said, they've looked at the lump in the lab, Molly, and I'm afraid it does show some cancer cells in it.
They told us that they tested the lump and it came back malignant, which means I had cancer in it.
I didn't cry or anything, but Mum was obviously really upset, like not in a good way at all.
It just totally took me by surprise. And do you remember what you said? Didn't I told you?
No.
You said, am I going to die?
And then I said, oh my God, I'll lose my hair. Because I feel like when people think about cancer, that's all they think about is being bald and you losing your hair. But luckily, with thyroid cancer, you don't have to lose your hair, which is probably what I'm most grateful for.
You seem to just go, okay, right, so I'm not going to die, I'm not going to lose my hair, what do I have to do? At the end of that, and I still don't think I'd spoken at this point. I think I was just totally in shock. I remember saying, it's been there for 3 years. And he said, yes, I know. And then they popped us in another room with a cup of tea because he knew I had to drive you home. And I don't really think I said very much. I think I just sat there in a bit of a state of shock. So Molly has follicular thyroid cancer.
When people say cancer, they think the worst and they think like nothing's going to be okay, but actually it's more scary thinking about the word cancer than the actual illness. Once they taught me through what was going to happen and stuff, I kind of understood it and I was like, oh right, okay, it's not as bad as I think it's going to be.
The young people that I've told who have thyroid cancer, they are more resilient than we give them credit for. Yeah, they take the news on, they own the news, they talk about it appropriately with their friends, and every young person I've told who's had thyroid cancer, I've always been amazed at how well they've been able to take on the information, absorb it, and then ask really appropriate questions about their care. I'm just constantly amazed by it. They're often just like, yeah, whatever. You're like, what?
Whereas your parents at the side of you are just absolutely in pieces and thinking, I have no idea how we manage with that.
You go through a whole range of emotions. I remember describing it afterwards, saying that I felt like the world had stopped turning. I didn't feel I could function as a normal human. I didn't go to work, which is most unlike me, but I just didn't feel able to be compassionate to other people when I felt so sort of rubbish myself.
When I tell someone they've got cancer, we can have a conversation for 40 minutes. And it's quite common that that person goes out of the room, goes to the car, and doesn't remember anything apart from being told that they've got cancer. So it's really important to support a patient. There are some fantastic organisations out there, Butterfly Thyroid Cancer Trust being one, that also offer fantastic information and direct support for these young people and their families, because this is a really difficult time. Butterfly Thyroid Cancer Trust have a parent support contact who is happy to talk to parents about thyroid cancer and share their experiences, and she's been through this herself. There are other charities out there that can also help, who specifically are there to look after patients and their families who have any type of cancer when they're young.
The next day I went to school at home.
Yes, and so we sat there for a while working out, making myself feel ready to drive home. Obviously phoned my husband, and then I said, you don't have to go to school tomorrow, but you were very much like, no, I do have to go to school.
I do actually quite like school, even though I don't say I do. And also because I didn't really want things to change. Like I was sort of like, as soon as someone tells you that you don't really want to just like change your whole life, you just want to carry on and like do it. So I remember you said that you didn't really want anyone to know, and you didn't really want me to tell school, and I didn't really understand that. Because like I didn't really want to be the kid that was ill. The thing is, like, when you're in high school, you don't really want to get that much attention and so. And I think a lot of people get really scared when they hear the word cancer. I don't think it's linked together, but once you hear that word, you just immediately think they're going to die or they're going to lose their hair, which wasn't the case. I remember saying, I am going to have to tell school, Wally, there's no way around it.
So when people get a diagnosis of cancer, there's going to be people that they want close to them, people that they want to tell, people that they have in their family and their friends that they want their support. But I think whoever gets told they've got cancer, I think, especially to start with, they need to think carefully about who they tell and when, just to make sure that they're not overloaded, with everything that's going on.
Once I found out, my mum told my dad and my brother. I don't know if my sister knew, because she was very young at the time. And then my granddad knew, my next door neighbour, and then I told my friends.
I told my best friend at the time first, and she jokingly said, "Do you have cancer?" I said, "Yeah," and then that was it really, but I wasn't. And I told some of my other friends, and they were all obviously sad and stuff, but they all kind of like, they were just like alright about it, so then they just say, "Yeah, okay." And then I told another one of my friends who was like, she was actually carrying a lot.
So when I told them, they were obviously upset, but it wasn't a massive deal, which I kind of liked, because I didn't really want it to be like a massive deal. Because I basically told them, look, this is what I've got, this sort of to happen. They were like, okay, fair enough, hope you're okay. And that was it, really.
I would say it's better to talk to people.
Yeah. But I couldn't convince you of that at the time.
The surgeon was absolutely great. He rang again the next day and spoke to me and my husband together on the phone to try and explain it, because I was sort of like, why has this been missed? Why was this not found? And he explained to me that, to make a diagnosis of cancer, the cells in the lump have to break out of the lump itself. Otherwise, it's not cancer, it's contained.
When we take a biopsy, we're only taking a sample of part of it, not all of it. And there are some situations in thyroid where no matter how many small parts of a lump we take, we can't know whether it's definitely cancer or not until we take all of the lump.
He said that when they looked at it under the microscope, there were 2 areas in which Molly's was invading a blood vessel and where it had breached the wall of this lump, and that in itself makes it cancer. But you wouldn't know that from just taking a few cells out of the middle of it. You wouldn't see where they'd gone. So it made sense to me, but it was just a complete shock.
Thyroid cancer is pretty rare. It does account for about 4,000 new diagnoses a year in the UK. It is a cancer, though, is actually slightly more common in younger people than other cancers. Thyroid cancer is essentially a lump within the thyroid gland of cells that where the cell growth is no longer controlled, so it's growing faster than normal cells. As with any cancer, that there can be a potential for cells to escape from the lump in the thyroid and to spread to other areas in the body. That is relatively unusual in thyroid cancer. Differentiated thyroid cancer, the focus of what we're talking about today, is by far the most common sort of thyroid cancer. That accounts for probably about 90% of thyroid cancers, and that includes 2 main subtypes called papillary and follicular cancers, and they're the types that most commonly as well affect this age group.
They used to get described as a good cancer. We have sort of tried to raise awareness of that, because we just said telling someone they've got a good cancer can just invalidate. If you're feeling worried about it, you just feel like, I can't really talk about it because it's a good cancer, I shouldn't be worrying.
It's devastating for anybody at any age, and particularly for young people.
We know that people will worry about it, but what we say now is it's a really treatable type of disease.
The good thing is that generally most, and particularly younger patients, tend to have a very good prognosis from thyroid cancer. So the vast majority of our patients actually are cured and do go on to live a completely normal life.
I don't feel the way I should when I look at me. I don't recognize that girl, and it's hard to breathe with all this weight on my lungs, and I can't see how I can do this on my own.
It's a very common question that I get asked, why has this happened to me? And the reality is, actually, the majority of the cases, we don't know. There isn't a good reason. It's just one of those things, and you've been unlucky.
So we know that thyroid cancer is not anything to do with lifestyle or anything like that. It's not anything to do with your diet.
There is nothing that anyone has done wrong to get thyroid cancer. And that's really important to explain to the young people that get thyroid cancer, and their parents.
But I think once you get over the initial shock, you then just want, right, what are we going to do about this? What do we need to do? And when is that going to happen?
When I deal with young people who are diagnosed with thyroid cancer, it actually involves a lot of other people than just me. Everything about their case and all of their scan results will be discussed in a cancer meeting that takes place. And in this meeting, we have X-ray doctors who will look at the scans, and we'll have the pathologists who will tell me about what the biopsy shows. There'll be myself as a surgeon, but there will be other thyroid surgeons there as well. And there'll be nurses and endocrinologists as well. So this group of professionals working together and putting their expertise together is called an MDT, multidisciplinary team. And we collectively put our thoughts into what the different options are and what the benefits might be of various options that are available to that person. Then it's my job to take the discussion from that meeting and then to relay that to the patient and their family, and then work with them to work out what the best treatment is for them.
They said, what we're going to have to do is we're going to have to take the other side of your thyroid out because it probably has cancer in it.
So then she came in, went back to the same ward, had the other half removed.
I was kind of happy because I wanted to get it out of me. Wasn't as nervous or scared this time because I'd already done it, the exact same thing, so I just knew I could do it again.
The risks were a bit higher this time. They were reopening the scar. They explained to me that they would try and make it look just as good as it did the first time, but it was being reopened. It might be a bit of a bigger scar. We went back in, she had that done.
It was a lot better the second time round because we knew what was going to happen. So it was a lot better the second time.
If we do an operation to remove all of a patient's thyroid, then we need to replace the function of that thyroid with tablets. The thyroid produces a hormone called thyroid hormone. We call this thyroxine. And once you've had all your thyroid out, you will need to take thyroid tablets, usually once a day, often in the morning, and fairly easy to take.
I received a phone call from Kathy, the Macmillan thyroid specialist nurse, and she came and explained that they would then just let Molly recover from the surgery, we'd get her onto a stable dose of thyroxine, and that we would be looking at radioactive iodine treatment.
Radioactive iodine ablation is basically a treatment that's given after people have had surgery. So ablation is basically getting rid of any thyroid cells, whether they're thyroid healthy cells or whether it's thyroid cancer cells. I think it's quite an amazing treatment. It's not something everybody has, but if we do have the concern that maybe there's any cells going elsewhere, the radioactive iodine would be given and it would zap these cells, basically get rid of them, and that reduces the chance of anything coming back in the future.
What we're taking advantage of here is that thyroid and thyroid cancer cells are one of the very few cell types in the body that take up iodine. If we give a patient then radioactive iodine, that will exclusively localise to those thyroid cells and won't go into any other cells. So that allows us to target really high doses of radiation into the thyroid cells without causing damage anywhere else. If the cancer has spread, it will treat those cells wherever they are. That's one of the aspects that makes it such a useful treatment.
You swallow a capsule that then makes you radioactive.
Yeah, sadly not.
Doesn't make you glow. It doesn't even make people feel generally unwell. Doesn't make you lose your hair. The worst thing it can do, it can give you a little bit of swelling to your neck, because it's targeting where the thyroid was. It does mean that you have to be looked after in a room by yourself for a short period of time, because you're basically considered a little bit unsafe in terms of mixing with other people.
We need to look after patients in rooms that have special shielding in. So like the room we're in at the moment, this is especially designed to keep the radiation in the room and avoid other people being exposed. We're quite fortunate here in Sheffield that our room was fairly recently refurbished. Actually, we're really grateful to the Butterfly Thyroid Cancer Trust, who helped with some of the artwork in the room that's just made it a bit more pleasant to be in. And I gather there are about 40 hospitals around the country that have also benefited from that sort of support to enhance the facilities in the rooms and make the patient stay more pleasant.
You have your own toilet, beds, TV, fridge, sink, which obviously you don't get when you've just had surgery. You have to share with everybody.
We do have Wi-Fi in the room, so you can access your devices. We try and make it a little bit more like a hotel room rather than a hospital room, really, because generally patients are not unwell while they're here with us. They're just here because of the radiation levels.
2 weeks before, I had to go on a special diet.
In the immediate run-up to treatment, we do like patients to avoid having too much iodine in their diet, because if you eat a lot of normal iodine immediately before the radioactive iodine, it can potentially compete against the radioactive iodine, and in theory that can stop it working quite as effectively.
If your body's lacking in the iodine, when we give you the radioactive iodine or radioactivity attached to the iodine, it will then sort of be desperate for it and soak it up like a sponge, and will help the treatment to work better.
I wasn't allowed to eat a few things like dairy and fish and eggs. I love dairy.
We bought loads of chocolate without milk in, and it was so expensive when we tried out all of them. And then we had cheese.
We had fake cheese, yeah.
Cheese, the feta was alright. When I went to school, I had to take a packed lunch, didn't I?
Yeah.
And when I went to the break queue, I asked them if the waffles had eggs in, because they weren't allowed to have eggs. And they said yeah, so I didn't get any food at break.
Most centres now will recommend just a week of a low iodine diet in the run-up to treatment.
On the 2 days before you come in, before you actually have the treatment, you have a couple of injections to stimulate any cells so that the treatment works better.
This is when you did the radioiodine. That's you with all the lovely things that the Butterfly Thyroid Cancer Trust had sent to you. Kate Farnell contacted me, and she's the founder of Butterfly Thyroid Cancer Trust. Kate had arranged to make the room a bit nicer for a teenager.
Butterfly Cancer Trust gifted me like blankets, pillows, stationery, toiletries and things like that to make the room seem a lot more like welcoming.
So you had pens and paper and things to keep you amused, and they'd paid for all those decorations. In that room you got slippers and pyjamas and all sorts of things, didn't you?
It made it a lot more enjoyable and less daunting.
I think the fact that there's a charity out there that's willing to do that is really great. That was just so lovely to feel like you had that support and people understood. That's a photo of you taking the radioiodine in your room.
I had to go into the room and take a tablet.
So it was a little capsule in the bottom of that big long tube, and do you remember they delivered it to you in sort of a big metal trolley, and then everybody else just left the room while you swallowed it.
There's quite a lot of drama around you actually having the capsule. They have like a lead trolley that's then, they take the lid off the lead trolley and they will bring out a lead container that then has the capsule inside. Because it's radioactive, we don't want you touching it, so we would then attach a test tube to the container, which then gets the capsule to soak up into it. You then put the test tube to your mouth and the capsule will be released into your mouth, and we give you a glass of water to then swallow it with.
It's not scary at all. That's all you have to do. Take a tablet. It doesn't hurt. You don't feel ill. You don't feel sick or anything. You just have to isolate for a few days.
How long you need to stay in hospital depends very much on how much iodine we feel you need to be given, and actually how quickly your body clears that. And that's surprisingly variable between different patients. So some patients we will just have in for the day. They come in the morning, have the iodine, and can go home by the end of the day. Some will need to stay longer than that. It could be for up to a couple of nights. Occasionally it's a little bit longer than that. If you have to stay in, we take some radiation measurements then to see how quickly the radiation levels are falling, and that then helps us to determine how long you're going to need to stay.
We'd ask that you have a couple of showers a day, and that washes the radioactivity from your skin. Anytime you're going to the toilet, that will then be getting rid of radioactivity, so we ask you to flush the toilet twice.
My mum could visit me, but she had to stay behind a line and wear this thing she strapped on her clothes, and it said when she had too much radiation, she had to leave.
And I could only spend a certain number of hours a day in the room with Molly. We spent a lot of time with me just sat in the door of the room, chatting, her watching her iPad. We both took up crochet because it was a long time just sat around, and I felt like I had to do something to keep busy with my hands. It basically just is a lot of sitting around.
It's definitely better than chemotherapy or radiotherapy or any other cancer treatment. So I was grateful.
On the last day, you have a full body scan. It's not an MRI scan, it's not a really enclosed scan, but it is quite a long scan in that it can take up to an hour or so. The scan assesses how well the treatment's worked.
When I got the scan, it was very early in the morning, so I just lay there and slept. It doesn't hurt or anything, you don't have to get any injections. And just to lie still. They were just trying to check if everything had worked right.
It normally can take 4 to 6 weeks for that to come back. In the majority of cases, I would say that they would get the results and one treatment is enough. We do a blood test before you go home, measuring what's called your thyroglobulin. Thyroglobulin is a protein that's produced by your thyroid. If your thyroid's been removed, then the levels will be lower. If you've had radioiodine, they'll be even lower. So we describe it as undetectable. So it would be something that we can use as a kind of a marker going forward. They will measure your levels of radioactivity before you go home.
They had to test if I was had low radiation levels, and they used a meter ruler, and they put it between me and the person, and then took a measurement, and then they saw I was ready to go. They said I could go home because all the radiation had left my body.
When you go home, it will be completely safe for you to be at home, but there may still be some restrictions that you need to take for a few days afterwards, because there will still be low levels of radiation on board. So things, for example, we may ask you to avoid close contact with other people still.
We'd ask that you maybe don't go out, so maybe not going to the supermarket, not mixing with other people for a few days. For
that period when you are having to take some precautions for those few days afterwards, you probably won't be able to go to school.
It was all good because all the treatment had finished. So it's kind of relieving.
The younger two, they seemed to have coped. Friends were amazing. People rallied round and did loads of things, helped with the other two. Schools obviously knew what was going on and they were keeping an eye out. It's been quite a big impact on school for Molly, partly because she didn't want half of them to know. And she had 3 chunks of time off school: the first surgery, the second surgery, the radioiodine. I think Molly became quite disengaged about school at that time. And I don't know whether that was a reaction to everything that had gone on. She didn't make a whole great load of effort to catch up with her work, and I don't think I pushed it because I felt well, she's had quite a hard time here, let's just cut her some slack.
The interruption that all of this causes, the disruption, can be really difficult to manage at a time that's really quite important to you when you're setting out on life and got ambitions. Many centres will have teenage and young adult cancer nurses who can really help provide that support and advice, and will liaise with schools, uni, employers, to try and make sure that there's an understanding of what's going on and measures are put in place to support that. And also just interaction with your peers, it is not a common or normal thing to have to deal with a cancer diagnosis or treatment when you're at that age. Your friends won't understand what you're going through. So I think that is particularly challenging.
We got a phone call from the paediatric oncology department at the LGI saying that the oncologist wanted to have an appointment with us. I knew it was the results, and Molly said she didn't really want to go to it. She didn't want to be part of it. She wanted us to get the results and then tell her. He said, we think it's probably okay, but there's some nodules in her left lung. And I remember just bursting into tears, just thinking, when will this end? And as a doctor, when a cancer spreads, you always think, oh gosh, is this going to be curable? But what they were saying to me basically is we don't know if this is anything to do with the thyroid at all, or whether this is just some bits of scar tissue or something that Molly's just got in her lungs that we found because we've done this really, really detailed scan. So she needs to go for another scan, a CT scan this time. So it just feels like you're on a roller coaster waiting for the next lot of bad news and the next lot of bad news.
After the radiation, I kind of just thought it was all over then. So when I got the results, they told me that they had nodules in my lung, which I remember my mum being upset about because she was like, just everything kept happening. Like every time we think it finished, something popped up. But they just told me I had to go and get it checked out.
So we went for that one, and they said, yep, she's got these tiny lung nodules, and they're tiny. We're talking millimetres. If it had been through the scanner 10 years ago, they wouldn't have seen anything at all.
They said it was all good and all fine, so nothing to worry about.
So that's caused quite a bit of anxiety, but they do a blood test called thyroglobulin. It's not made by any other tissue in the body. If you have no thyroid and then you've had any remaining tissue killed by the radioiodine, you should have no thyroglobulin. And that's one of the really sort of reassuring things about this type of cancer, is that they have got a really good way of monitoring it. If anything's spread and any thyroid tissue starts growing anywhere in your body, it should start to rise this level. And at the time these lung nodules are seen, her level was undetectable, and it has remained undetectable or very, very low ever since. So they feel on balance these are probably not related to the thyroid, but she's still just having yearly scans, yearly CT scans to just check that they haven't grown.
About 9 months after radioiodine, we do like special blood test and we do a scan. And what we're looking for is to see whether the whole treatment that someone's had, the surgery and the radioiodine, has that worked? And when we do those blood tests and that scan, what we're looking for is, can we find any evidence at all that there's any thyroid cancer there? And often when we do that, there's no evidence whatsoever, and the thyroid cancer is gone.
We go to appointments like every 6 months.
Yeah.
Now, and I get scans.
Once a year.
Once a year.
We will continue to look after them for a number of years.
I still get regular blood tests. I'll say once every 3 months, but everything gets longer and further apart. So every 2 weeks I used to get blood tests, now I get them every 3 months. So everything just keeps getting more further apart, which is very good.
Was a period of time when we came to this hospital every day for 2 weeks, didn't we?
Yeah, it was quite fun because we get along quite well.
We spent a lot of time together.
We want to make sure that we keep an eye on them. Although the cancer has gone, there's often a small chance that the cancer could come back.
You'd also get referred to an endocrinologist a couple of months after you've had your radioactive iodine treatment. Molly was already under the care of an endocrinologist anyway, and some people are. They help to make sure you're on the right dose of your levothyroxine, make sure that you're feeling okay and that everything's working okay.
So do you want to come in and just have a seat? So really just to see how things are going at the moment.
Fine.
Typically then we would keep on with follow-up for up to about 5 years, but we know if things remain well to the 5-year point, there then is a very, very low risk of further recurrence, and you would then probably be discharged to the care of your GP.
The likelihood of things coming back is very, very slim. It's something we don't see very often at all.
If it does, we can catch it early and we can treat it.
If you notice anything, then just flag it up to us.
Any sort of worries about how you're feeling?
At the end of this really, really long roller coaster, I am just thankful that this is a cancer that we can cure for most people. She's had the treatment. There's never been any indication that we need to do any more. I was told if anything happens, if we find that it's recurred anywhere, she can have the radioiodine again, and that should sort it out. Really, for her, it's just regular blood tests to get her, make sure the thyroxine level's right. I wish she wasn't having to take thyroxine for the rest of her life, but if that's what we've ended up with and a cure for cancer, then I think anybody would choose that.
It's hard to remember the take them and everything, but you just have to do it, I guess. And once you get used to it, it's fine because you have to do it for the rest of your life. So it's like, it's not a bad thing to have to do for the rest of your life.
I think the first thing I say is don't panic. There's lots that can be done. It isn't always as bad as you fear. The treatment, it's not great, but it's not terrible. It's certainly you can cope with it. And I would also say if you're struggling, pick up the phone. There's loads of people that could support you and talk you through it. The Macmillan nurses have all been fabulous. Kate from Butterfly Thyroid Cancer Trust has been amazing, and she has a team of people that you can pick up the phone and speak to and get advice. So just don't be afraid to ask for it.
It's like we've always known, but set in stone, unbreakable.
I'll just say that it might seem bad, but it's not as scary, and if you just have people around you that you love, then I think it'll be fine. And just make everything as comfortable as you can. Like when I went to hospital, I took things with me, like crystals and like massive tellies, like my massive Percy Pig toys, just because just bring things that comfort you and do things that you enjoy, like distract yourself and entertain yourself, because the worst thing you can do is just sit and worry. So I just watched films and got hobbies and occupied myself really.
Molly's doing great now. She's absolutely fine, in good health, in the middle of her GCSEs, which has not been great, but I don't think that is for any parent. And we're just looking forward to them being over and a nice long summer for her, and then on to sixth form. I actually think it's brought Molly and I closer together. It seems a million years ago now, but we spent so much time together. And that's when you went for your first surgery. You were very pleased with your gown, but you wouldn't take your trainers off. And we still laugh about all our trips to the hospital. It always seemed to be on a Monday. And Molly always said, I'll do my motivational Monday talk. And then on the way there, she'd tell me all the things we had to feel grateful for.
I just feel grateful because it's treatable and I'm fine now. I trusted the doctors and it worked out.
To be honest, through the whole of it, she's just taken everything in her stride. It's more the parents that were panicking.
Once you finished, you just feel like, well, that's it. Like, that's the part of my life done, so I can just move on and just live normally.
I kind of feel like, well, we've dealt with this. We'll deal with whatever comes next.
Think of all the times we lay looking up out at the stars. Nervous Cause of the way you make me feel, you're setting fire to my heart. Before you, oh, what was that? I don't recognize, now I'm looking back. How I adore you, it can't be mine.